Welcome to our Women's Health podcast series. My name is Abigail Hole and I'm a Communications Assistant at Bournemouth University. Through this podcast, I'll be speaking with members of the Centre for Midwifery and Women's Health to learn more about women's health and the amazing research being conducted by the Centre. In this episode, I'll be speaking to Dr. Emma Thurston, Senior Lecturer of Physician Associate Studies, who is currently undertaking a PhD looking at feminist bioethics in contraception. Hi Emma, how are you today?
I'm really well, thank you.
And could you introduce us to what your research study is currently looking at?
Yes, so my PhD title is a feminist multi-method qualitative study exploring how hormonal contraception impacts women's sexual pleasure. I'm talking to women, getting their lived experience of how being on specifically hormonal forms of contraception has impacted their sexual pleasure. I'm really particularly interested in taking, like you said, the feminist bioethical lens, so looking at the history of medicine and how that was really developed in an androcentric view, so through the male lens really, and really focused towards males being the norm of the human body. I think it's really important and timely because we realise that the uptake of hormonal contraception has really reduced in the past decades, and the impact on sexuality has been shown in studies to be a real significant factor in why women are not uptaking the offer of hormonal contraception as much as they used to, and the delegitimisation of side effects. So when they go and talk to a clinician about the side effects they're having on hormonal contraception, that really not being considered as important. And alongside that, the abortion rates are the highest they've ever been since abortion became legal and data was collected on that. So I think this is all coming together, and actually we really need to make sure that women's whole selves are considered when we're offering them reproductive autonomy options.
And just to summarise a quick definition of what female bioethics is.
Yes,
a brief
overview. Yeah, so it's noting the imbalances in the sex and gender system and how that plays out in social and ethical issues surrounding medical practice and the life sciences. And one of the tasks of feminist bioethics is to challenge medicine's androcentrism, so the standing assumption that men are the norm for human beings, and call attention to the ways in which this marks women as either unimportant or pathological.
And I know when we spoke previously over email, you're saying about the title of your research study has changed. So how has your research evolved over time and why did you change your title?
Yeah, so initially I was really focused on sex ed and was thinking of doing more of a PhD focused on sex and relationships education at the school level, particularly in the formal sex ed space. Part of that is because, although I'm an academic primarily in terms of how my working week works, I'm also by background a general practitioner with a special interest in women's health. So I see women on a weekly basis in clinic in the NHS. So it was really seeing how a lack of education had really impacted their lives, both from a social point of view, a psychological point of view, but also in the medical point of view, and how women coming to see me, they didn't know the right terms for their bodies even. So, you call everything the vagina rather than the outside bit being the vulva. And actually their lack of understanding of how to gain sexual pleasure, or even sexual pleasure seeming unimportant for them. And actually having discussions about how sexual pain's not normal. And even just basic things like this, and just seeing that play out so often in my clinical room, and just thinking about how we had got to that state that women just seem so neglected in this area. So that's where I was going to go. But actually, there's quite a lot of research already there. So obviously part of a PhD is producing novel insights into the field and really making a difference. And I feel that the contraceptive lens brings in my background in medical practice, and I've got a master's in public health as well. So brings in those aspects of my background into my PhD.
And of course, we know that contraceptives can also affect sex drive sometimes, and the impact of that. So is that something you've noticed that people have queries about when they come thinking about what contraceptives to go on? And is there a certain contraceptive that's more inclined to affect someone's sex drive?
My research is hopefully to, draw to light on is that this is something that's really impactful to women's lived experiences and their whole lives and their holistic well-being, whereas we don't really consider it in medicine and we haven't looked into it. So that's where the research is really lacking. In terms of hormonal profiles, yes, there's non-hormonal forms of contraception. There is more localized forms. However, there are some systemic effects of the IUS. So the IUD is a intrauterine device, which is the copper coil, which is non-hormonal. Then the IUS is the intrauterine system, which is the progesterone releasing hormone. It's releasing a synthetic form of progesterone, so technically it's a progestogen, but colloquially we tend to just say it's progesterone. And that's something that is branded, and they have different doses, but the most well-known is called the Marina coil, but you might something like a J-Des or a Kalina. There's different brands as well. Most women feel like there's less whole body side effects from those more localized devices, but some women do report effects more systemically, so like with their mental health and that sort of thing with the coils as well. But generally speaking, yes, absolutely less whole body effects of the hormones. But it's where the research is lacking, and I think it's really interesting. And one of the things that I find both hopefully very hopeful but also very frustrating at the same time is that we're really getting to a stage now where there's reversible forms of male contraception, which I think is really empowering for both men and women. But the care and dedication gone into developing male hormonal contraceptions and male reversible non-hormonal forms of conception is significantly different to that given to the women's contraception, and considering their whole selves and their side effects. And actually some trials and drugs in development have been stopped because of the effects that men were reporting in the trials, and they were exactly the same as what women suffer when they're on contraception. And I think this shines light on what we can call the gender compulsory birth control or gender compulsory contraception, where it's really women's responsibility to be contraceptive in society, particularly, I think, in more long-term relationship, and how that's actually really unethical from a feminist bioethical point of view. And there's a really interesting study by Ariane Shavinsky, who is from Brighton and Sussex Med School, and she looks in more like the philosophical side of medicine, and she's written a paper in the Journal of Medical Ethics called Towards Responsible Ejaculations, the Moral Imperative for Male Contraceptive Responsibility. And she says that women have the double burden of the risks of pregnancy, the risk of childbirth, and the side effects and risks of contraception. And to make it more gender equitable, men should take on the burden of contraception. And I think that's a really interesting concept, and one that I really can see a lot of value in. Whereas it's really interesting in the medical world, you're taught, well, women have the risks of pregnancy and childbirth, so therefore there is an ethical point of view that the risks and side effects of contraception can be slightly more because they are being protected from that contraception, from the risks of childbirth from a medical point of view. Whereas actually ethically you should share that burden and those risks in a partnership. But I also think it's really exciting in a way that there's some real innovative ways of developing male contraception, that if we took those efforts into the female form and had the same innovative out-of-the-box way of thinkings, we could potentially really revolutionise female contraception and have both sexes being able to control their fertility as much as they wanted.
What common misconceptions do you hear as a GP about women's sexual health?
I think it's that their sexual pleasure and their enjoyment in sex doesn't matter. I think I often ask women, particularly say if they're going through the menopause. We know that menopause, one of the symptoms that can arise particularly later on through the menopause transition, is vaginal dryness, and that can really impact women's sexual pleasure and cause sexual pain. But they just feel it's part of that stage of life and it's part of being a woman, just have to put up with it. But also that's one of the main things that can happen in contraception, particularly combined pills. So things like Yasmin and that sort of class of a combined pill can really impact vulval elasticity, vaginal elasticity and lubrication, which can cause sexual pain. Whereas even medically, I wasn't even educated about that in my training. And how then can you appropriately counsel women about that, or ask them to pay attention to it? And if there is something that they feel like this medication and this form of contraception is the best for them, make them aware of the possible side effects and to come and seek support if they need it. And also lactating women, so women who are breastfeeding have the same potential issues. So it's just making them aware that they don't have to assume it's just part of being a woman and actually something they have to put up with. I think that's one of the most important things.
We previously spoke to Anna Marsh about her PhD, which is currently looking at how social media might be used in midwifery services to kind of share education and resources. Women are sharing their lived experiences on contraception through social media, online forums, reviews on websites and other online channels. But what are the benefits and advantages of using online reviews, and what are the disadvantages of that to inform decision making on contraceptives?
So thinking about the positives, I think sharing lived experiences in a community where women feel safe to do so on social media or in other platforms can really generate a sense of community. And if you're getting the information from appropriate sources with the knowledge, it can actually be a really great area of education, so people can learn about their bodies, learn about their options, and that I think can really help support decision making in a way that women have a lot of time to think about it. And I think in, say, like a classic 10-minute GP consultation, you might be educating women and trying to provide them as much information as possible, but it can be information overload, and it's finding that balance between giving the women enough time to actually make their decisions. So I think by having that information in more of a drip-fed way where people can digest it and make the decisions, that can be really helpful. I also think it can really start movements and raise awareness of the issues that women are living with. But there are some negatives, and I think every woman's experiences are unique, and scientifically, unfortunately, we're not there yet to understand, say, for example, if you go on one form of contraception, how that's going to affect you compared to your best friend or someone that you read about on an online forum. So I think it's just acknowledging that, and some people don't understand that. So if you read about how someone who posted on an online forum and they experienced something, you might experience something completely different on that. So actually, it's not always representative of what your lived experience will be. And it's not a regulated system. So there's a lot of myths, incorrect information, and quite frankly, scaremongering that can go on in these platforms, which I think is harmful. So there's some amazing benefits, but there are some negatives as well.
What resources and websites do you recommend to people who come to you?
Really depending what their concerns are and what stage of life they're at. So there's a women's health strategy which was released in August 2022 from the government trying to improve women's health. And they have developed something called the life course approach. So it's just acknowledging how women's needs vary across the life course. And I think that's really true for what resources you might recommend. So if someone was coming to me wanting to understand what their contraceptive options were, for example, there's a really good website called The Lowdown, and that's like TripAdvisor for contraception. So women have put all their reviews on, but it also teaches you what the different options are and what forms they take, like how would you take that, those sorts of things. So, are they something that, for example, with an implant you get put into your arm and can leave for 3 years, or is it a pill that you have to take every day? Those sorts of things. They've also developed more communities now for PCOS, endometriosis, and I think infertility. They're expanding as we go. So they're quite nice, again, for that sense of community. For sexual health, Brooke is a good charity that provide a lot of information, and Sexwise. And then in terms of, say, cervical health and women's gynecological health from the 5 top cancers and awareness in terms of vulval self-checking, the Eve Appeal is amazing. For other stages of life, so menopause, you've got sort of things like Menopause Matters, and there's a few good podcasts. But there's some really good books. So Come As You Are by Emily Nagoski is like a Bible of like women just understanding themselves and sexual pleasure and their anatomy. Come Together now is a follow-up about long-term relationships and how sexual pleasure and desire changes. We're kind of taught through media and TV shows and everything about how we should have this thing called spontaneous desire, which is when you just spontaneously, for no apparent reason, although it often is subconsciously triggered, but for no reason you suddenly feel horny and you want to have sex, and that's kind of deemed like what it should be like. Whereas actually, particularly in long-term relationships and particularly for women, we have this more responsive desire where arousal kind of leads into desire rather than the desire leading to arousal, and that can be really empowering for particularly women in long-term relationships who think their sexual desire is wrong. It's not what it should be.
There's a lot of campaigns that celebrities get involved with as well. I saw a recent one that Jamila Jamil, who does the I Weigh podcast, she was recently posting about the website called Love Sex Not Porn, which is basically a campaign around signposting to real people who are having sex and not this portrayal of sex through other porn sites that might trail a different perspective that's always focused around penetration and not around physical things like touch and hugging and kissing and all those things. So that's kind of something that you have to also educate.
Yeah, absolutely. And I think that was one of the things that, again, drew me back to looking at sex education and how, because that is lacking, and because online pornography is so prolific now and really easily accessible, particularly through channels that you wouldn't particularly expect, like Twitter or on Instagram, and actually people who are not looking for it can become exposed to it, and how it really is, it's designed for adult entertainment rather than sex ed. It's not a form of sex education. Young people using it as sex education get this really skewed view of what sex is that really isn't very healthy, particularly when you go down these rabbit holes of getting more and more violent and misogynistic porn. And classically, the free porn is really high proportion of misogynistic and actually violent acts portrayed in that. Whereas actually, if you're going to say potentially more feminist and ethical porn, that is, whilst yes, still designed for entertainment, a little bit more representative of what actually healthy or normal sex can look like. We know that studies that show that 44% of women who were in a relationship with a man who had looked at porn were asked to enact those acts that were seen in porn. And for example, we've seen a massive rise in the number of young people engaging in choking during sex, and that is directly linked to choking being portrayed in pornography. And actually I think that's where we really need to engage in a conversation around porn in an unshameful way and just really explain what it is and how it's not a real representation of sex. And like you said, how sex is not just penetration, that we've seen this very heteronormative model of what sex is. And that is very, like say, heteronormative, reproductive in focus. But we know that penetration, so penis and vagina sex, is at a population level what heterosexual men prefer the most, but actually what heterosexual women prefer the least. So it's their least favourite sex act. So actually, again, going back to female sexual pleasure, and understanding vulval anatomy rather than just vagina and the internal reproductive system, that really can be empowering for women to actually understand their bodies and know what suits them. And that's not just for young people, but for older people as well. We know that erectile dysfunction rises significantly as guys get older, but if they have all their lives learned that sex means I'm putting a hard penis into a vagina and then they can't do that anymore, how they have challenges, that can be really psychologically distressing. Whereas actually if they learn they can do a lot of other things and have orgasms with flaccid penises, like people don't get told this stuff, but actually it can be really much more psychologically beneficial for both men and women learning about how encompassing sex can be rather than there's just one act we tend to like put on a pedestal.
So you're a keynote speaker at an Understanding Health talk on menopause with Rosie Harper, who spoke to you previously on this podcast about pelvic floor dysfunction. Why is it important we have discussion about women's health within communities?
I think one of the main benefits of talking openly about women's health is minimising the stigma and taboo around all of women's health. And that has so many positive benefits, from like the education state of actually women understanding what is normal and knowing when to seek help and not putting up with either pain or say like with periods heavy bleeding just because they've been told that's normal and what women put up with and what life is like as a woman, actually knowing what's pathological and what's the rounds of norm. And I think it's acknowledging aspects of women's lives that have often been hidden away or seen as dirty. And I think it really improves understanding and empathy from all sides if we just have open conversations. So I think there was some menopause education in a school, and actually some of the teenage boys were saying, actually, if I'd known that, and I think with hindsight, my mum would have probably been suffering with some of these symptoms. Maybe she was a bit more irritable at some times than she would have been, and I wasn't very nice back. But actually having understand that's where she might be coming from, I would have had a lot more empathy and just actually been a nicer person to her. So I think it's just like having that empathy when we've often not talked about these aspects of women's life. And I think reducing shame and stigma is also really important in terms of reducing marketing and vulnerability to capitalisation. For example, we have a feminine hygiene aisle. I have never seen a masculine hygiene aisle. And all these products women are marketed to for wipes and scenting. Vulvas are not meant to smell like roses. And
actually, say about pink tax, don't they?
Yeah, the pink tax, yeah. So actually the fact that actually, menstrual products have only just had the tax deducted from them, but actually then period pants were involved in that for a while. I think they are now. So yeah, it's just a bit obscene and how much commercialisation there is for these products, which make women feel really insecure as well. And actually, I've never seen a masculine wipe to make testicles smell like roses. It's just like, why are we expected to have this? And actually they can be really harmful. So douching can disturb the vaginal microbiome, and all these wipes and products, and even things like scented and flavoured lubes, if you're particularly vulnerable to dysbiosis, so that's an imbalance in the microbiome within your vagina, that can really trigger things like bacterial vaginosis or thrush. So it's actually really not helpful for women's health, and actually just leave it as it is. It's a self-cleaning mechanism, and actually if you have any discharge that is offensive or heavier than you would expect for your norm, that's when you go and seek help and a clinician to see if there's anything pathological going on. And other things like just by openly talking about these and women's reproductive health issues, how many of us have shoved a tampon up our sleeve in the workplace to actually go and change a tampon? Menstruation is something that women, particularly not on contraception or maybe on contraception that causes irregular, more frequent bleeding, they will be living with menstruation or withdrawal bleeding for a significant part of their life, and we just hide it away and feel like we can't talk about it. Whereas actually, if you were able just to change a product without feeling shame in an office or thinking that it's dirty. And the connotations of menstruation being dirty can be really detrimental to women just from feeling shamed. But actually from the practices we see in other countries, say like Nepal, where women, they can't share beds with their partner when they're menstruating, so they have to sleep on their floor, or they even get sent to menstrual huts where they've died of hunger, thirst and environmental issues. And that all comes back from menstruation being shameful and dirty, which does have some religious connotations to it as well. So I think having open conversations, just put this all out in the open and actually feel that there's more empathy in society about women's lived experiences, but also can help women seek support when they need to, but just not feel ashamed of natural processes that are going on in the body.
I know in Scotland they have in public toilet sanitary.
Yeah.
It'd be great if in, all universities and schools that they would be able to provide products.
Yeah, I think they've tried in schools, in education settings, to bring in sort of free period products, because period poverty is such a big issue. And you think of it maybe being in more lower socioeconomically developed countries, but actually we know in the UK it's a real issue for particularly, say, like young girls living below the poverty line, but feeling, again, too embarrassed or ashamed about it to go and ask for them. So I think, period poverty for so many reasons can impact women, closer to home than maybe we think.
I know I've seen a lot in service stations about period poverty and donating to those causes, but I wonder if those advertisements that are asking for donations are also in the men's toilets. Because I wouldn't be surprised if they weren't.
Not.
Because,
yeah, exactly.
Like you say, it's seen as a women's issue
exactly.
and not a men's issue also. In that talk, you spoke about taboos and the shame which surrounds women's sexual pleasure through their life cycle. Can you talk to us about some taboos you found through your research?
I think there used to be particularly a taboo around solo sex, but I think that's actually really important. There's a lot of research showing how actually there are some health benefits, so reduced stress, improved sleep, improved immunity. But I also think for the young people or people who just never engaged in solo sex or solo pleasure before, it really teaches people what they like and how they like to be touched, and gives them a sense of a really safe way of exploring their body. And I mean safe from abuse, safe from STIs. It just can be really empowering. And then you can go and communicate that to a partner if you do engage in partnered sex about actually what you like, which can actually be really helpful for partners as well if they do want to pleasure you. So I think that is something that particularly for women has historically been seen as shameful or not something that's very dignified or ladylike. And I think also thinking about the life course, like you said, elderly people engaging in sex, I think actually that's seen as quite taboo, but actually is something that can give a lot of pleasure and meaning and intimacy to more elderly people. And I think actually being able to embrace that is really important. And actually there's a really interesting book called Magnificent Sex by Peggy Ornstein, and she's done some research into what makes sex magnificent. And there was an average age at which people had their first really transcendental sexual peak experience, and that was in their 50s. So I think it's actually quite also optimistic if you think about it, that actually people who might not have engaged in sexual pleasure, might not have really been empowered in that way, learning that actually it might be later than you think in life that actually peak sexual experiences often come around.
And in the Understanding Health talk, you spoke about the importance of an improved sex education curriculum through schools. What recommendations would you suggest in education to give a more balanced representation of female sexual pleasure?
I think a few things. I think very simply, women are taught their internal reproductive anatomy. So if you think about it, something that looks like the ram horns. So you have like the ovaries, the uterine tubes, the uterus and the vagina, but we exclude the vulva, which actually is where the vast majority of women get most of their sexual pleasure. And actually that's also disempowering from sort of things like from a medical point of view and a clinical point of view, women and girls self-checking their vulva to understand what's normal for them so they know if any conditions arise, as well as the sexual pleasure piece. So it's kind of got two angles that's really important. But then also when women seek care, they're going back to what I said about what kind of drew me to this research. I have to be really empathic with women using the wrong terms. So it's like I've got something on my vagina and kind of asking if that's on the inside or the outside, because they've not been taught the right terms to use. But it can therefore hinder clinical interactions if we haven't actually taught them even just the basic right terms like vulva, vagina, labia, those sorts of things. And also I think, like we've kind of talked about before, an age-appropriate discussion about porn and how porn is not sex ed.
I think science can, in a way, be a bit of a barrier as well, because they give such long, complicated names to things that just to retain information of what all these names of different areas are, it's quite hard to remember.
Like I say, you don't have to make things complicated. And again, having age appropriateness is really important. I think, for example, teaching bodily autonomy, you can teach 5-6-year-olds that they don't have to hug their uncle and aunt if they don't want to. And actually, that if the uncle and aunt feels offended by them not hugging, that's their problem, not actually the kids for not wanting to give them, and actually not pushing children to do, not hug, not high five, not do things that they don't want to of their body. And that is teaching bodily autonomy in a very age appropriate way, whereas it might be different for a 16-year-old.
I do think now I'm 24 when I reflect back on when I was at school and high school and the education I got, I can't remember anything touched on about menopause. It was always about reproductive health and not about after reproductive
and I think
health.
That's another point, is that actually I think we teach from a historical point of view and from a clinical point of view about teenage pregnancies being more risky, but we are so therefore focused on pregnancy prevention. It's kind of a STI and pregnancy prevention plan rather than actually like an embodied sex and relationship life course approach to empowering people to make the best decisions for themselves. So we could really focus on pregnancy prevention, but we don't actually have any fertility education about what will maximise your fertility if you were to want to get pregnant. Education for me is, I think, the better approach, because that gives the information for people to make the right decision. But we are already below the birth rate in terms of replacement rate in a lot of countries. But I think ultimately it's their choice what they do with their life, whether they have children or not. And I think we need to embrace that actually some women might not want to have children as well.
I still find it quite shocking, some things in the UK though. I recently read a Conversation article about police investigations into women who have lost babies late in their pregnancy, and the questions and things they're asked as part of that process. I wasn't aware that was an investigation that was considered so criminal. We
still have a criminal law governing abortion rights in the UK, and there's a bill coming in that was going to be debated about how do we decriminalise abortion in the UK to reduce the weeks at which it's legal to have an abortion and to stop at-home abortions, which actually can be really supportive for women going through an abortion. Not right for everyone, but absolutely can improve access to women, particularly in quite dire situations like domestic violence and that sort of thing. So we're really in this political knife edge, like in America, and I feel like we kind of feel like America's a bubble, but actually there has been a lot of political campaigning and a lot of money behind what people call pro-life, which I think, if you actually consider the life of the woman as well as the fetus, is actually very much not pro-life, and it's just pro-forcing women to have children, because they don't support the women to support the children growing up once they have been born. And I think, so there is a lot of political debate at the moment about abortion, but like you said about going back to the women being prosecuted for potentially even the thought that they might have had an abortion. Women have been penalised for having an abortion at a higher rate than they have since the law came in, which I think is 1867, the law came in. So yeah, we're really at this kind of politically scary time, I think.
So you co-lead the Women's Academic Network. Can you talk about the aims of the network and how you're implementing change?
Yes, so it's really trying to give opportunity for female academics to prioritise what they need to particularly do their research and have the time and space to do that. We know that females in academia tend to do more of the pastoral nature of the work, so the tutoring and those sorts of things, which take time out of what is deemed more significant for, say, academic promotion and all those things. So it's giving women the space and time to focus on what they need to career develop, but also provide networking opportunities and raise awareness for, like say, the issues that are specifically related to female academics, and provide that network of support and collaboration within the university.
And my last question for you, which I've asked every woman through this podcast series, is what conversations about women's health do you feel we need to be having more of, what we're not talking enough about?
I think mainly reducing shame and reducing the impact of the sort of commercialisation feminine hygiene industry that shames women's bodies, and understanding that you're all unique. There's nothing to be shamed about in anything about women's health, and giving the education that women need to kind of make the decisions that are best for them.
Thank you so much for joining me on this podcast. If you'd like to find out more about the Research Centre, please visit the Bournemouth University website.